When someone is critically injured in an accident or some other kind of catastrophic event, they're usually taken to a trauma center, which is best equipped to save their life.
Maine is about to lose one of those centers. So the state currently has 3 trauma centers: a level 1 center at Maine Medical Center in Portland, a level 2 at Eastern Maine Medical in Bangor, and a level 3 center at CMMC.
But beginning December 1st, the trauma center in Lewiston will cease to exist. The reason, CMMC says, the cost of getting that trauma certification is simply too high. News Center Maine's Raya Wooten has been talking with hospital leaders about what this change could actually mean for patients.
She is outside CMMC tonight with more. So Raya, what have you learned today?
Ryan and Amanda, you may remember that this hospital played a critical role in treating trauma care patients after the Lewiston mass shooting that happened in this community 2 years ago. Now, some of the patients with the most serious injuries may be diverted to Maine's other trauma centers due to protocols that are put in place by Maine Emergency Medical Services. Central Maine Medical Center says it all comes down to cost. Hospital certifications come with large expenses.
So the trauma certificate costs upwards of $500,000.
Dr. Aaron Clark from Central Maine Medical Center's emergency department says that's not a cost CMMC plans to pay. Hospital leaders announced Monday they will not renew CMMC's trauma care hospital certification. Starting December 1st, CMMC will function as a trauma services hospital like most hospitals in Maine.
Effectively, from a clinical, what kind of care we can provide to patients, there isn't any difference.
Clark says CMMC still has clinical care doctors, nurses, and operating room staff, reminding that the hospital already outsources to other hospitals.
We take care of patients in our community to the best of our ability, and that is not going to change as of December 1st.
Although Clark says CMMC's ability to care for patients won't look much different, Maine Emergency Medical Services currently has protocols in place, stating trauma patients at high or moderate risk for serious injuries should be preferentially transported to a trauma center if the total transport time is less than 45 minutes. That could mean the difference between traveling to Eastern Maine Medical Center in Bangor or Maine Medical Center in Portland instead of CMMC in Lewiston.
We do expect additional trauma patients to come to Eastern Maine Medical Center with this announcement. We stand ready to absorb those patients.
I am not worried about Maine health system and our ability to care for the trauma patient. What I am worried about, though, is really what this announcement symbolizes.
Leaders from other health care organizations in the state say that this shift is just another sign of the immense pressure that Maine's health care infrastructure is under. Reporting live in Lewiston, Raya Wooten, News Center Maine.